Peripheral neuropathy is not a minor or small problem or condition. For many individuals, it becomes a progressive, degenerative, and deeply disruptive health challenge that affects mobility, stability, independence, and overall quality of life. Symptoms often begin subtly: mild numbness, intermittent tingling, occasional burning, alterations in temperature, but unfortunately, it leads to progressive weakness, difficulties, and loss of independence. What makes neuropathy particularly distressing is not only the symptoms itself, but the uncertainty that surrounds them. Many patients are told, learn to live with it, manage the symptoms, and progression is expected. At TruRoots Health Center, we believe patients deserve a more thorough explanation. Peripheral nerves are living, metabolically active, healthy tissues. Their ability to function and potentially recover depends on several critical physiological factors, one being adequate vascular supply or circulation, consistent oxygen delivery, proper nutrient supply, healthy nerve signaling, and balanced inflammatory responses. When these systems are compromised, neural tissue may become irritated, dysfunctional, and be progressively damaged. One of the most common findings we observe in neuropathy cases is impaired circulation at the micro level. Nerves require a continuous supply of oxygen and nutrients to maintain electrical signaling, cellular repair, and structural integrity. When blood flow is reduced, nerves may struggle to perform even basic functions. Think of being trapped underwater for too long. Anytime you feel that starvation for oxygen, your nerve tissue feels that too. And if it's robbed of that critical element, it will begin to progressively die. And when that nerve tissue breaks down, symptoms are going to result. Unfortunately, conventional care frequently focuses on modifying your perception of those symptoms rather than addressing the underlying environment that the tissue's dying in. While symptom management has its place, many patients are left without a clear understanding of why the symptoms developed in the first place, why they're persisting, and why they may be actually worsening, and what factors may be involved. This lack of clarity can be one of the most emotionally exhausting aspects of neuropathy. Patients often describe feeling frustrated, discouraged, and uncertain about their future mobility and independence. Neuropathy is rarely driven by one single factor, which is why our clinical approach emphasizes a comprehensive evaluation of nerve health, neurologic integrity, structural integrity of your spine, and circulatory health and function. Your assessment is designed to identify measurable objective data and not run under assumptions. Depending on your presentation, this will include a Toronto Clinical Scoring Assessment of your nerve function, a circulatory assessment to evaluate blood flow, balance and stability analysis, neurologic and structural examination, and imaging when clinically appropriate. Following your evaluation, our team will perform a detailed review of your findings. If we believe your case is one we can responsibly and confidently accept, we will provide you with a clear and evidence-based discussion outlining the objective findings, contributing physiological factors, realistic expectations for improvement, and individualized care recommendations, timeline, as well as investment details. Our objective is not to offer false reassurance or exaggerated claims. Our goal is precision, clarity, and clinical honesty. Because when patients understand what is happening with their body, uncertainty is replaced with direction. If you're experiencing neuropathy symptoms and seeking a more thorough, physiologically driven evaluation, we invite you to request a consultation. You deserve to understand what may be contributing to your condition and what other options exist.